All right, everyone. Welcome, welcome, welcome. So glad to see you here. Prayerfully, my mic is working. Yes, it is. And just wanted to say, welcome, everyone. So glad to see you here. Just wanted to thank everyone that has subscribed. Looking forward to more subscribers. Make sure that you subscribe with us. All right, because it's very important. It's going to allow you to be able to get the information that we're sharing with you. It's going to let you know when we are going live, and it's also going to let you know, allow you to chat in the chat. So to be able to do that, you must subscribe. Okay. So what are we going to talk about today? We're going to talk about prostate cancer today. All right. So the main thing is understanding prostate cancer. We're going to look at what is prostate cancer, symptoms of prostate cancer, causes of prostate cancer, and how to allow your body to be able to heal prostate cancer. Okay, so this is a very powerful video. This will be the last video that we do on cancer in this series, and so just want you to know that we've gone over a whole series of cancer. If you have not seen the first cancer video, it's very important that you watch that video first before you watch this video. Each one builds upon each other, but that initial cancer video, there's a lot of things that I'm going to go through that I'm not going to go through tonight that you need to know in order to understand prostate cancer. So in order to watch any of the replays, the full replays, you need to go to patreon.com, patreon.com/health class, and subscribe to any one of our paid tiers. With those paid tiers, you will be able to watch all of our YouTube videos. If you decide to get the health class videos, you'll be able to watch all the health classes as well. And then you can also come to our health class that we have live. If you decide to move to the Getting High with Dawid phase, you can watch all of our meditation, mental health, as well as creation series classes. And then if you do Walk with Dawid, we will walk you through the process of healing yourself, or allowing your body to heal itself, rather, as well as getting you up to speed on your meal plan. We'll create a meal plan for you and walk you through the process of allowing your body to heal itself. Okay. So with that, before we go any further, I'm going to give a disclaimer. Oh no, before we do that, I want to thank all of our members that are on our Patreon, and all of our members or subscribers that have come to the YouTube and have subscribed with us. So we greatly appreciate you. You are special, and we do appreciate you as far as that's concerned. So without any further ado, we're going to move forward, and I'm going to give the disclaimer, and we'll be right back with the class.
Disclaimer. The information contained in this video is intended as an information resource only and is not to be used or relied upon for any diagnostic or treatment purposes. The video's information does not create any patient-physician relationship. Dawid Yisrael makes no representations about the accuracy or suitability of this content, as scientific and medical information updates and changes daily as more substantial information is discovered. Dawid Yisrael and any business associated during this video shall not in any event be liable for any direct or indirect damages, losses, injuries, or liability whatsoever suffered as a result of your use or misuse of this video's content. Use of this video is at the viewer's sole risk.
All right, everyone. So this is a very important video, whether it's for you, for your family members, or anyone. This prostate cancer is important. This is one of the #1 killers in the world, or in America rather, when it comes to health. Okay. So we want to look at, first of all, what is prostate cancer? Prostate cancer is a disease that occurs when malignant cells, right? Now we got the word malignant. Remember this, right? Just like we found in breast cancer, all right? And just like we found in uterine cancer, right? It's the same thing. When malignant, these are serious cells. These are the cells that are going to spread. When malignant cells grow out of control in the prostate, a gland in the male reproductive system, okay? Now, what are the symptoms of it? Okay. Symptoms include frequent urination, weak urine flow, blood in the urine, pain during ejaculation, and pain in the lower back, hips, or upper thighs. However, some types of prostate cancer grow slowly and have no symptoms. Okay? It's very important to get. All right? So now, we're going to look at the American Society, Cancer Society. What do they say? Prostate cancer begins when cells in the prostate gland start to grow out of control. And we found out that was malignant cells, right? The prostate is a gland found only in males. It makes some of the fluid that is part of semen. Okay? Now, the prostate. The prostate is below the bladder. All right? So we want to see the prostate is where? Well, we know here's the bladder, right? And we got the urethra here, right? The seminal vesicle, and then the prostate is here, okay? A cancerous tumor will be inside of this. So it's below the bladder, underneath it, basically, right? And underneath the urethra here. And this is prostate. So there could be a cancerous tumor inside of the prostate, all right? So we want to make sure there's no cancerous tumors inside of the prostate. So the prostate is below the bladder, the hollow organ where urine is stored, and in front of the rectum of the last part of the intestines. Just behind the prostate are glands called seminal vesicles, which make most of the fluid for semen. The urethra, which is the tube that carries urine and semen out of the body through the penis, goes through the center of the prostate. Okay? It goes through it. This is where the urethra comes. This is why you're going to have slowed down urine. So, right? So if you have slowed down urine, a lot of times it can be prostate issues, but it can also be prostate cancer, right? If you let it go too far. Okay? Now, so the prostate, even if we look on this side, we see where the penis is, the scrotum is, the prostate is right back here, right before you get to it. And it can block, right, the flow from the bladder through, right, to let your urine out. All right? Very important. The prostate tends to grow as a man ages. In younger men, it's about the size of a walnut, but it can be much larger in older men, right? This is where we get in the term what? Enlarged prostate. Types of prostate cancer. Not saying that a larger one is enlarged, but it can grow to where it becomes enlarged. Almost all prostate cancers are adenocarcinomas. Now, where did we see this before? The same thing in women, right, when dealing with endometrial cancer, right? So adenocarcinomas, and notice it's a carcinogen, right? So go back and watch the video that I dealt with oxalates, because it has oxalates, and we also dealt with cruciferous vegetables, which were we dealt with oxalates, goitrogenic compounds, as well as carcinogens in that. Very important to watch that so you can understand how cancer is being formed. Almost all prostate cancers are adenocarcinomas. These cancers develop from the gland cells in the prostate, the cells that can make the prostate fluid that is added to the semen. Other types of cancer that can start in the prostate include small cell carcinoma, right? Just like it can in a woman, small cell carcinoma, small cell neuroendocrine carcinoma, other neuroendocrine tumors, including large cell carcinoma, transitional cell carcinoma, and sarcomas. Okay? Now, what we didn't see in the woman was transitional cell carcinoma. I don't remember that one. Right? These other types of cancers are rare. If you are told you have prostate cancer, it is very likely to be adenocarcinoma, just like in the woman. Adenocarcinoma. Some prostate cancers can grow and spread quickly, but most tend to grow slowly, just like in the woman. Okay? Now, possible precancerous conditions of the prostate. Some research suggests that prostate cancer might start out as a pancreas condition. In some cases, these conditions are sometimes found when a man has a prostate biopsy. Okay? That's where they take out the prostate and to look for cancer. Prostatic intraepithelial neoplasm, or PIN. In PIN, the prostate cells don't look normal when seen with a microscope, but the abnormal cells don't look like they are invading the other parts of the prostate like cancerous cells would. PIN is not cancer, but it can sometimes lead to a higher risk of prostate cancer. Based on how the patterns of cells look, PIN is classified as either low-grade PIN, if the pattern prostate cells appear almost normal, or high-grade PIN, if the pattern of cells look more abnormal. Low-grade PIN is not thought to be related to a man's risk of prostate cancer. I would not agree with that. And I'm going to tell you why. Because if you watch the video that I did, I believe it was on breast cancer, I talked about how as we study these cancers, we're starting to notice that they start from lower level diseases. So, for instance, diabetes or high blood pressure might show up, or this or that. If you do not correct those issues, they grow into a situation in your body that will start to appear as cancer. So if you have low grade PIN, that means this is the time to start changing everything, or your livid or your diet back to a livid, in order for you to be able to reverse it. Right? This is when you make the difference. This is when you make the changes. At this stage, low grade, or if you have something showing up, like your blood pressure starts getting high, or you feel pain, or your urination starts, coming out slower, right? If you're losing that, or if your bladder's still holding urine, these are all signs that you have an issue that can lead to cancer. Cancer, in my opinion, is the last stage. Cancer is when you've been so disrespectful to the body that your body says, I ain't doing it no more. All right? So if you have joined us, please make sure that you hit the subscribe button. It's going to allow you to be able to chat with us or talk with us or anything like that. Please make sure that you have subscribed. All right? It's also going to give you and let you know when we go live. Now, proliferative inflammatory atrophy, PIA, right? In PIA, the prostate cells look smaller than normal, and there are signs of inflammation in the area. Okay, PIA is not cancer, and it's not yet clear if PIA might lead to high-grade PIN or prostate cancer. It's inflammation. Okay, it's an inflammatory disease. Okay, this is very important. All right, welcome, Sunshine Pumpkin. These are signs of inflammation in the area. All right. So we want to be careful with that as well. Now, the next stage of development. This is one of their drugs that they use. I'm not going to say take their drugs at all. I advise you not to take drugs. It's your choice, but my advice is never take it. But I want you to there's something I want you to understand that they talk about in here. When it comes to prostate cancer treatment, it helps to understand your type of prostate cancer and how Arleada can help. If your doctor has prescribed Arleada, it's because you have one of the types of prostate cancer described below, okay? So, what is metastatic castration-sensitive prostate cancer? Prostate cancer has spread to other parts of the body and still responds to a medical or surgical treatment that lowers testosterone. So remember when we were talking about breast cancer, and I believe all the other ones, but definitely breast cancer, it showed that even if the cancer started in the prostate and spreads to other organs, it's still going to be called prostate cancer. They're saying as long as it responds to lower testosterone levels, stopping the cancer, okay? This is called metastatic castration sensitive prostate cancer, or MCSP, all right? Now, metastatic cancer has spread to other parts of the body, okay? So metastatic means that it's spread to other parts of the body, which we know that already. Castration sensitive still responds to a medical or surgical treatment that lowers testosterone. So they call lowering testosterone castration. All right. And then prostate cancer. I wanted y'all to see that. Okay. Now, The exact cause of prostate cancer is unknown. That's what they're going to say. But we know what? That's going to be your liver or diet, really your diet, because the liver's not going to lead you to prostate cancer. It's going to be your diet that's going to cause prostate cancer, right? But there are many factors that can increase the risk of developing it. So age. The risk of prostate cancer increases with age. Now, that's not true. Why would prostate cancer increase with age? Why would it do that? The reason it will increase with age is because you've been filling your body with the wrong food. Over the years, it builds up. So as you get older, if you're not eating the optimal lipid, you're going to get cancer. Period. That's going to happen. There's no way around that. And most cases are diagnosed in men over 50. So it takes that many years for you to start building something up to give you cancer, for it to show up as cancer, right? Or it could be your lifestyle. You could be around radiation for so long. You could be around this or that. It can cause cancer. Family history. Men with a father, brother, or grandfather who had prostate cancer have increased risk. Why? Because they are eating what? The wrong food. So if your father was eating it and you grew up with your father or your brother or your grandfather, the grandfather probably had it. The father was eating what the grandfather was eating, taught your siblings and you to eat the wrong things. Now all of y'all gonna have prostate cancer. So that makes perfect sense. Yes, but it's not hereditary in that sense. It's not like you have you have cancer because of your father. So if your father has it, you're gonna have it, or your grandfather, you're gonna have it. No. It's if you do continue to do what your father did, then you're gonna have cancer. Yes, that is true. Having a close female relative with breast cancer may also increase the risk. Why? Because she's eating what? What you are eating. It's not gender specific. It's going to come for both of y'all. Ethnicity. African American men have a higher risk of prostate cancer. Why? Because most African American men's diet is worse than all other nationalities on the planet. We were tricked and lied into believing in something called soul food. Soul food is the most deadly food on the planet. We have to get as far away from what we called soul food as possible for the African American man, right? So this is why we have the higher prostate cancer than the Asian American or Hispanic Latino men, because our diet is the worst on the planet. Our diet is. Right? But if you go to Africa, they're not going to eat like that. That's why it's African American men. They don't eat like we eat. Our natural eating, and I was just thinking about this, like when I was in Ghana, I ate mostly salad and fruit. Lettuce, tomatoes, every day. It was lettuce, tomatoes, avocado. That's pretty much what we ate. Peppers possibly, right? And then we had fruit all the rest of the day. That's what we ate. And they eat meat, but they eat meat at a much lower rate. But I didn't eat meat, so I felt better than ever. And I was just thinking about that today, like, man, I was really on the optimal limit when I was in Ghana, more than anywhere else. And so you will find that the way that we naturally ate, these are our food. Like if you drop meat out of the African diet, or the African diet, yeah. If you drop meat out of the African diet, you're going to be on the optimal limit on everything else that they eat. Everything is all optimal. You ain't gonna run into no cruciferous vegetable. They don't eat that. You ain't gonna run into no leafy green vegetables like that. They don't. They eat lettuce, literally. Like, and you'll hear they'll always say, "You want lettuce? You want this? You want that?" You won't hear them talking about no greens and this and that. They don't eat that. They eat lettuce, right? So that's what I'm saying. So that's why I felt so good. Like also you're around the sun all day long. So that's beautiful. You get your vitamin D. It's beautiful. It's lovely. It's excellent. Right? So this is why African American men have higher risk of prostate cancer than Asian American or Hispanic Latino men. Weight. Being overweight in your 50s and later might increase the risk of advanced prostate cancer. Okay? Overweight, obesity, with every single quote unquote disease that we dealt with, every single one of them, all of them had obesity. All of them. You can't show me any disease that we have gone over so far that did not have obesity. Obesity is so dangerous, it's ridiculous. Diet. Some evidence suggests that a diet high in calcium, really? So there go your leafy greens. Gone. They're high in calcium, aren't they? High in calcium, right? There goes your milk, right? It's gone. Calcium, because you don't need it. Just like the protein game, calcium is the same game. We just learned about calcium before we learned about the protein myth. Most people, right? But calcium is just as dangerous in high quantities. Increase the risk of prostate cancer. Gene changes. Inherited gene changes. All right? Now, where do we get gene changes from? If we remember, right, the carcinogenic video, what happened? Carcinogens change genes, which is what? Cooked food. Cooked food changes your genes. The acquired gene mutations that happen in cells during a person's lifetime can also lead to cancer. Of course it will. Why wouldn't it? That only makes sense. Other factors: smoking, prostatitis, sexually transmitted infections, right? STIs, they're saying, but UTIs also. And exposure to Agent Orange may also increase the risk. So these things can cause cancer. All right? I want you to get that. Now, what's next? What causes prostate cancer according to the American Society? Notice they don't have nothing on food. Everything they're going to talk about is gene changes, inherited gene mutations, and acquired gene mutations. Now, they ain't going to tell you in these that cooked food will change your genes. It will mutate your genes. But we went through that when we dealt with part of the breast cancer. When we were dealing with cancer, that video, and when we were dealing with the carcinogenic compounds, that video, the oxalate video, which is super important video. So this right here, what causes prostate cancer, that's the only thing that they're going to deal with. They don't deal with food at all. They don't deal with nutrition. They don't deal with any of that, right? They don't even deal with this, estrogen. Yes, there is evidence that estrogen can play a role in prostate cancer. Estrogen. So what has estrogen in it? Those things we need to remove. Studies have shown that high levels of estradiol, and a high estradiol to testosterone ratio can increase the risk of prostate cancer. All right? The prostate expresses both estrogen receptor alpha ER and estrogen receptor beta. Okay? ER alpha is thought to have a harmful effect on the prostate, while ER beta may have a tumor suppressive effect. However, the role of ER beta is still unclear, and some evidence suggests that ER beta isoforms may be, oncogenic. Okay? Estrogen production. The prostate can produce estrogen, and aromatase can be abnormally expressed in the prostate. Estrogen and inflammation. Estrogen can cause inflammatory events in the prostate, which you never want. You never want inflammatory events in the prostate unless it's healing from something. But you don't want it to be just inflammatory for no reason, which can lead to what? Pre-malignant lesions. Remember, pre-malignant lesions. So it's going to create lesions in the prostate that will become malignant cancers. In other words, all right. Estrogen and cell proliferation. Estrogens can be involved in local cell proliferation in the prostate. All right. So we want to be very careful with that. Estrogen is a beast. Now we're going to deal with testosterone. Right. Let's deal with that. And it says testosterone causes prostate cancer. No, testosterone does not cause prostate cancer. And in fact, some evidence suggests that testosterone therapy might reduce the risk of developing prostate cancer. Men with low testosterone levels have a decreased risk of developing prostate cancer, though, which is good. Testosterone therapy does not increase the risk of prostate cancer. It may even reduce the risk. Let's see. The saturation model suggests that high endogenous androgen levels do not increase the risk of prostate cancer. However, testosterone is necessary for prostate cancer cells to grow. In fact, prostate cancer cells require some testosterone to exist. When testosterone levels are very low, prostate cancer cells can proliferate. When hormone levels are elevated, the cancer cells differentiate. So basically, no, testosterone doesn't, but estrogen does. Okay? This is very important. I want us to remember that, retain that for as we move forward. Now, what we're going to get into, we're going to talk about how to reverse or how your body can begin to naturally heal itself of cancer.
For the rest of this video and more videos like these, you can join us at patreon.com/health class. Again, that's patreon.com/health class. And join one of our paid tiers. Any of them will do. And you join one of those tiers, you can watch the rest of these videos, as well as all the other videos that I produced, including my former health classes, which is 4 to 8 hours of information that can help you on your health journey to the top. All right. So I look forward to sharing that adventure with you. I look forward to seeing you at the top of your health